Hey everybody, welcome back. This is Dr.Surindher here, your friendly neighborhood plastic surgeon. So today we're going to be answering a few more questions and clearing some doubts regarding the procedure which is called a breast lift. So what is a breast lift? So breast lift is basically lifting up sagging breasts with or without an implant. If there is no volume loss, then you can just lift it, and if there is a lot significant volume loss, then you can use an implant along with it and also do a lift to bring the breasts back into the normal shape and to bring the nipples into the normal position, and of course to remove the excess skin. So that is basically what is involved in the breast lift, is removal of the excess skin, bring the nipples into the right position and tighten the gland as well. So why does this happen? So as you know, in the normal breast there is the glands, and of course there is fat. So what happens is, when during pregnancy and breastfeeding, the breasts are enlarged. So once they enlarge, they replace the fat there, and once the breastfeeding is over, then the glands involute and go back to their original position, but the fat doesn't come back. So there is a disparity between the envelope and the content. So that is why there is a large envelope with small content, and that is why the breasts sag. The more fatty the breast initially, the more sag later. Secondly, also during pregnancy, if you don't look after the skin of the breast properly, then what happens is there are stretch marks, and stretch marks skin never shrinks back. So when the gland is involuting after breastfeeding, the skin doesn't shrink, and that is why you have a large envelope, that is the skin, with a smaller content, that is the glands. So that is how this happens. Okay, now we have a saggy breast. How can they be corrected? So what we need to do is basically trim that excess skin and bring the glands back into position like how they were. So as you can see in the picture, you can see that we do certain maneuvers where we are removing some of the excess skin, and then we are putting it back into the right position by rotating the nipple and the areolar complex, as we call it, the NAC. And if needed, then we can add either an implant, or we can add your own tissue from the lower pole which is now sagging. We lift it up and fix it so that the upper pole fullness comes, the nipple is in the center position, and the shape of the breast is like how it was before the pregnancy. So that is how a breast lift is done. So what are the options? So options one is that we can, as I said, how do you decide whether you need only a breast lift or you need a breast lift with an augmentation? So when you wear your bra, if you feel that your breasts are okay and they are full, your bra cup is full, but as soon as you remove the bra, you know the breasts are sagging or falling down. So that is when you need only a lift. But when you're wearing a bra and you feel that the bra is empty, and when you remove it there is a sag, that means you need both. You need a lift as well as an augmentation. And the third option is when you have a mild sag and the breast feels empty when you wear a bra. So there you can correct it only with an augmentation, because the lift might not be too much, so only volume loss is the cause. So we just replace the volume, so that itself gives you a lift, because now the volume is fuller and it takes up the excess skin. But that works only when the skin quality is very good and the sag is not too significant. So these are your three options. So another query that we get is, are there scars in breast lift? Yes, sadly there are scars in breast lift, because we are actually removing and cutting the excess skin that is there, and then we are restitching it. So the internal glandular part is of course corrected, but the outside skin also needs to be removed. But nowadays what we are doing is we're doing something called a short scar breast lift, where instead of an old anchor scar which was like a whole anchor and then a T, nowadays we're doing only with a lollipop scar, which is basically a stick and around the nipple. So most of them can be corrected by this, but yes, if the skin is too excess, then of course we might have to do a small T underneath that as well. And but it is still, here the gland is reshaped and we rely on the gland to hold the shape rather than just the skin. So that is why the longevity of the results is longer. Another thing that we do for most of our breast lift patients is something called auto-augmentation. So what auto-augmentation does is, normally when we're doing a breast lift, there is the saggy portion of the breast which is underneath the nipple, and that most of the times is excised. But with our technique, what we do is we use that tissue to augment the upper pole, because as the breast is sagging, there is a loss of the upper pole fullness which gives you the cleavage. So we add that tissue into the upper pole. So instead of an implant, we are using your own tissues to add it to the upper pole to give you a little more fullness and a little better shape of the breast. So that is basically what is called auto-augmentation. Sometimes we can also add autologous fat grafting or add some fat into the upper areas to give it a better shape. Of course, that is an ancillary procedure or an extra procedure which can be done. But yes, these are your two options, and that is what we call as auto-augmentation. So when should it be done? That is again a question which many of us ask, and ideally, yes, we need to do it after you finished your family and finished your breastfeeding, because then the changes or the forces which act to cause these changes are not there. So you're not going to get pregnant again, it's not going to enlarge, it's not going to shrink again. So now you're finished with your family, so now we finally set everything right, and that should take care of it for the rest of your life. So ideally, yes, you can do it after you've finished your family, 1 or 2 kids or 3 kids, whatever it is, and once that is done, then we do the final reshaping. Sometimes we can do it in between 2 kids as well. So it all depends on the situation, and it depends on how you feel about your breast and how you're feeling, how the situation is and how bad the sag is. So sometimes we do it in between 2 kids also. In those cases, we try and tend to add an implant most of the times. So what that does is it gives you a little bit of elevation and the volume of the implant stays. But the very important caveat that we give is, when you get pregnant again, you have to look after your skin very properly, and we will give you advice for that, so that you prevent any stretch marks, so that when this breastfeeding is over, it shrinks back to its original position and the skin also shrinks. So that is what happens. So yes, it all mainly depends on the situation, on when you want it, whether how you feel about your body, and whether you want to do something about it right now. But ideally, it should be after you finish your family. Another common query is, will it sag again? Ideally, it should not. That is why we are doing it after you finish your family, because the process of expansion and skin expansion and the gland expansion are all not there, because you're not getting pregnant again, you're not having kids again. But some amount of natural sagging will occur as you age. The resagging is more of a problem in patients with massive weight loss. So say somebody was about 150 kilos, they got a bariatric surgery, they're now about 60 or 70. So what has happened is, when they were gaining weight, everything is stretched. The skin is stretched, the ligaments are stretched, so the sag is more. So, and if we want to preserve the function, we have to maintain a pedicle. Pedicle is basically a stalk which brings the blood supply and the nerve supply to the nipple and areola. So when you want to preserve the pedicle, so then you have to leave some tissue behind. But that tissue is also saggy tissue, because it has the ligaments and everything which are stretched. So yes, this repeat of the sagginess can happen in some patients, but it is more often seen in patients who have undergone massive weight loss. And yes, it can be recorrected over a period of years. If there is a bit of a sag, then you can do some minor procedures to lift it up. Not normal, but yes, in some cases, especially with massive weight loss patients, this can be a problem. And for that, you can use an implant which might help. But because the skin is also stretched, the ligaments are stretched, and everything is loose, So yes, there are chances that it can happen, but in most of the other patients, like when we do a mommy makeover, that should not be a problem at all. Another very common question that we get is, no, we don't want surgery, we want something non-surgical. These are the changes that have happened in your breast are because of internal forces which are literally stretching them apart and tearing tissues apart. So your dermis is torn, that's why you have the stretch marks. Your ligaments are stretched, your fat is gone which was already there. So anything to do non-surgically that is going to correct all these problems is very unlikely. You have certain machines which will do some RF machines which they say tightens your dermis, tightens your this thing, but when you're talking about sagging in a breast, that is quite significant. So anything like you do non-surgically from the outside doesn't really solve your problems, because it doesn't remove the skin excess, it doesn't tighten the ligament, it doesn't reposition your breast, the nipple into the normal position. So non-surgical really doesn't work. Yes, you can try it if you're afraid of surgery and scars, you can try it, but it's not going to give very significant results. For minor sagging, yes, it works to a certain extent. It will just help you with the skin sag and may tighten the this thing. The similar is the issue with threads. Again, with the threads also the same problem. The sag is too much for the threads to be able to correct all that. In spite of us doing a surgical correction where we are removing and cutting the skin and reshaping the gland and putting an implant, even then we tell you that okay, there might be some chances that the skin might sag again or the breast tissue might sag again, because gravity is constant and aging is constant. So to expect a non-surgical procedure like just to do some creams on top and to apply some machines on top and some threads, that really is not an option when you're talking about actual sagging of the breast. So non-surgically doesn't work. Surgical is the only option, or you just leave it alone. Okay, there is no sense in doing something which is not going to work and then feeling frustrated about it, that we spend the money and then even you're not getting the results. To a certain extent, you will have a result, but that is also in very selected cases and in smaller individuals with good skin quality and not much of sag. So when you have significant sag, you have larger breasts, you have saggy breasts which are significantly sagging, and there is no volume, it really doesn't work. So yes, these were some of the common queries that we get when it comes to breast lift, and most of our patients after the breast lifts are quite happy because they regain their confidence, they know that how it feels now, and they feel they get back to how they were and what kind of dresses just to wear, or even simply go to the beach and wear a bikini. So there are a lot of advantages to it. The flip side, yes, is it has some scars because we have to remove the skin. Once you remove skin, there are always scars, but the scars are now minimized. We do the short scar breast lift, so the scars are minimized, and you can get some volume back if you want. You can either use auto-augmentation or you can use an implant, and it definitely does give you a lot of self-confidence, and it improves your body image. You feel a lot better, and so that is what the whole process is done for. So if you have any other queries, feel free to get in touch with us. Okay, let us know if you have any other doubts that you want cleared, and we'll help answer them. And all the best. Keep watching us. Like and subscribe to our channel so that you can get more information like this. And we believe in giving you the right information, and it's not a marketing gimmick. So we want you to be well educated and well informed about any procedure that you're going to undergo, and you also understand the limitations of what can and cannot be done on the body. And so that is our aim in this channel, and that is what we hope we are providing to you. Thank you for watching.